This debate is about saving money. That's what we thought it was about. But no longer. We have an agreement on the cuts and savings. I was there in the White House last night. And that agreement includes a historic level of cuts. We've always recognized we had to make cuts. That's why we agreed in the White House last night to make significant cuts.
Why, after Speaker Boehner offered a number and the president accepted, why are we still here today worried about a shutdown that will hurt so many? The answer is very simple. The so-called extraneous riders, these add-ons, which have nothing to do with deficit reduction, are standing in the way.
This is not a debate in the last hours before this government shuts down about how much to cut. It is about whether or not women in this country will have access to basic health care services. Mr. President, as a woman, as a mother, as a grandmother, I find that appalling.
Why? Well, it is because of problems within the House Republican caucus. The Speaker of the House, John Boehner, whom I know and respect and like, is surrounded by lean and hungry colleagues challenging his value, his resolve, and his leadership. This House power struggle has now reached a point where we face a government shutdown and a showdown on whether or not we are going to provide basic health care access for women across America.
What kind of country are we that at the 11th hour on a debate like this, the issue remaining is about women's health care? I find that stunning.
Now, Speaker Boehner is trying to say today it is not these riders. It is the budget numbers. But that is belied by two facts. One, he offered a number to the president last night and the president accepted $78 billion in cuts. And two, if it were not the riders, as my colleague from Washington State has said, and let me repeat, if it's not the riders, Speaker Boehner, take them off the table.
Republicans want to shut down the government because they think there's nothing more important than keeping women from getting cancer screenings. This is indefensible, and everyone should be outraged. Men and women should be outraged.
Let's not close down this government. Let's face this hour of decision responsibly. Let's say to the millions of critical federal employees across America who are basically keeping America safe, making sure that our planes are safe in the air, tending to the business of this great nation, that they can come to work because the government will not close at midnight.
The consequences of letting our country's funding expire would be devastating to people, individuals.
Let us not close down the government of the United States of America over the access of women to basic health care. That is what the House Republicans are insisting on, and it is the wrong fight at the wrong time.
As a legislator, I'm very frustrated. As an American, I'm appalled. As a husband, a father, and a grandfather, I'm personally offended.
My plea now to Speaker Boehner is, you have fought the good fight. We are at the 11th hour. Do not let us reach the depths of despair by closing down our government and sending a message across the world that there's something wrong with this American form of government. There's nothing wrong with it. There's nothing wrong with it. The people of good faith responsibly stepping forward and accepting their duty in the House and Senate can't cure by agreeing today. Let's do it. In this hour of decision, let's get it done.